My name is Vanessa Jurado. I am a speech-language pathologist. I have been a speech-language pathologist for 17 years, and I've had the great opportunity to work at Del Sol Medical Center for 8 years. Usually when we walk in the room and we say, "Hi, I'm a speech therapist or speech-language pathologist," their response is, "I'm speaking just fine." So sometimes that is a misconception that we're only teaching them how to speak. But as a speech-language pathologist, we touch on many areas. One would be communication, and so we know there's a receptive component and expressive component. There's cognition, so cognition is everything that you do to get ready to plan, initiate, and organize, and sometimes after a assault to the brain, so whether it's non-traumatic like a stroke or traumatic like a head injury or a motor vehicle accident or bleeding in the brain, there are challenges and changes in that area. Our main goal is to return them to their baseline or as close to their baseline as possible. In an acute care setting, we again work together with the team, the nurses, the doctors, to promote communication, cognition. We work on swallowing, and what we want to do as a team is promote the best outcome for our patient. One of the other areas that we address is voice restoration. So an individual that may require a tracheostomy, so once they are medically stable, we will address voice by utilizing a Passy-Muir valve. Another area that we target a lot in the hospital is swallowing. We use a couple different presentations at bedside, mainly water. If appropriate, we'll move on to more solid presentations. We want to make sure that the food is going to be able to go in and that they'll be able to swallow to, again, be able to take their medication safely, meet their nutritional needs and hydrational needs as well. So another area that we look at is cognition and communication. And so as a result, we try to use a lot of external memory aids, which could be as simple as a board. It could be your phone with your calendar or alarms. My favorite part about being a speech-language pathologist is the opportunity to work with individuals through the lifespan. So we're talking birth all the way to geriatric population. Definitely what I love about rehab is that we are a team. We work together as an interdisciplinary team with physical therapy, occupational therapy, speech therapy, our nurses.